So sexuality begins probably from the day that we're born. And I'm interested in all of that. So as I talk through these things, have a think about for yourself how this relates to you. We're born into a family, and we're born with our own biology, with our sex, our gender. And we're born into a family that has their own ideas around sexuality, which can have an impact on us. That might be cultural factors, it might be religious factors, and through growing up in our family, from what we're told, what we see, even what's not said, if there are taboos around sex, our learnings about sexuality begin in that way. We develop over time our likes and our dislikes and our beliefs around sex and the meaning that sex has for us. But what research has shown is that many women continue to try and keep having sex for all sorts of different reasons. Perhaps, because they feel they should, or for their partner's sake. So there's something else going on. And that is this sense of duty or should. And that then leads into feeling pressured, and the anxiety and the stress and the tension, and it's sort of going along that top line. Those are the things that I think of as getting in the way. Okay, so if we're talking about the management of sexual problems, the first thing I'd like to say is please seek help. Unfortunately, research shows that too many doctors and healthcare practitioners just don't bring up the topic of sexuality. Now, that might be because they're too busy with all the other management issues, which are very important, of course, the treatment process. But it might also be because they're not comfortable with the topic. And sadly, research also shows that patients don't bring up the topic. That might be because it's not important, and that's fine. And it may only become important later on down the track. But also, research shows that patients are protecting the healthcare practitioner. Either they're embarrassed in themselves, but they might think that the doctor or the practitioner is embarrassed. Now, I really hope that you will bring it up. Bring up any concerns or worries. Bring up the topic. And if the person you're seeing is not comfortable with it, or downplays it, fobs you off, then either ask for a referral to someone else or seek help somewhere else, because it is a very important thing to be able to talk about.